And joining us tonight to talk more about this and the warning signs is Dr. Joe McBride, an infectious disease physician from UW Health. Dr. McBride, welcome back. Good to see you again.
Thank you.
So is this coronavirus something infectious disease doctors like yourself are familiar with, or is this something new?
Well, this particular virus seems to be new from what we have at this point. Coronaviruses really describe a whole family of viruses, and coronaviruses we can see in Wisconsin, we can see in Madison. It could be a common cause of the common cold, but this particular coronavirus seems to be a novel and new virus.
So it mutates, or how does a new virus come to life?
Right, exactly. So viruses are made up of DNA just like any other living thing on this planet. There can be mutations in the DNA which allow it to maybe jump from one species to another or become a little bit more dangerous or virulent, as we say.
So this one apparently causes pneumonia-like symptoms, which is similar to the SARS outbreak.
Right.
So are you starting to put the puzzle pieces together about what to look for?
So coronaviruses themselves can cause respiratory tract infections, and it's a spectrum of disease. So even with this new novel coronavirus, some people might just have symptoms of a common cold, but other people could have more dramatic symptoms with pneumonia or even severe respiratory failure and death.
So it's treated like a pneumonia?
Yeah, it is. So when people would have this type of disease, and if they had a severe case, what they would do in the hospital setting is try to maintain them breathing properly. Sometimes they might need mechanical ventilation, like a breathing machine. They would maintain their blood pressure appropriately. So it's a lot of supportive care because there isn't any direct medication to try to cure this virus.
As far as we know, it's highly contagious. So is it just a matter of time before is it something we need to be concerned about here in southern Wisconsin?
So great question. We really don't know too much about the virus. It's relatively in its infancy for our knowledge at this point. There does seem to be data that it is person-to-person communicable, so it can be transmitted with coughs and colds. But so far, there's really minimal evidence that there's a high risk for people here in Wisconsin and here in the United States in general. And also, just on the other hand, this is the height of flu season, certainly. So coughs, colds, that's much more likely to be influenza than a virus that is coming from abroad like China.
So no reason to lose sleep at this point here in southern Wisconsin?
Right, in southern Wisconsin, if you had these symptoms, again, vast majority of people are going to have something like flu, which we're used to, but yet still can be dangerous, and I certainly would still seek medical care. But your risk for this particular coronavirus at this time is, again, very, very low.
Slipping on the ice is probably a bigger hazard.
Yes, I would agree.
That's true.
All right, we'll keep an eye on this, and we'll have you back if necessary. Doctor, thanks for being with us.
Dr. McBride, great to see you. Thank you for coming today.
Thank you.
Final check of your forecast coming up.
Your roll playback.